Bom, a gente já começou a aprender bastante com essa jornada que a rastreabilidade está trazendo aqui para o país, né? E é interessante, porque se a gente vê aqui a questão da quarta revolução, a gente olha aqui na época, foi matéria aqui com mais ou menos umas 10 páginas, e parece que é algo de São Bernardo do Campo, ou seja, só tem a ver com a ABC. E a saúde está totalmente fora da agenda, né? Então, eu acho que é uma oportunidade, tudo que a gente está discutindo, tudo que nós estamos aprendendo, para incluir esse tema como um tema prioritário para o Brasil e não ficar só restrito a São Bernardo, as montadoras, mas sim talvez até uma saúde 4.0, e eu acho que talvez é isso que o professor tem colocado para nós, talvez o que nós estamos aprendendo aqui seja o início do asfalto, como o professor Dr. Krieger falou, né? Então, agora a gente vai ter um novo painel. Esse painel vai ser vamos tentar trazer uma visão ainda do contexto que nós estamos. Gostaria de chamar o professor Eduardo para compor a mesa, que vai ser o mediador dessa mesa. Na sequência, eu gostaria de chamar o Dr. Brian, do MIT, que se dispôs aqui a enfrentar, acho, 14 horas de voo para estar aqui com a gente. Dando continuidade, gostaria de chamar o Dr. Matthew, da Roche, para também compor aqui a mesa, responsável por todo esse projeto no mundo inteiro. Obrigado, doutor. E finalizando, eu gostaria de chamar a doutora Laura, também para fazer parte aqui da mesa. Muito obrigado, doutora.
Vamos começar essa sessão, né? Estou substituindo o professor Giovanni aqui. Espero estar à altura da incumbência. Vamos começar com o Dr. Brian.
Okay, now can you hear me? Okay, excellent, good. So it's a pleasure to be here. We've done a bit of preparation in terms of the table and what we're going to be talking, and I'll be giving a broad perspective on Internet of Things, and then later my colleagues will talk a bit more about, in particular, what's happening with pharma supply chain and traceability. And I think there is one area which is the traceability for the supply chain of getting visibility of what's happening. And I'll be trying to talk more about the future, what are other things that we can trace. And I'll try and give you some examples from outside pharma and some from inside the pharma industry that are trying to be a bit disruptive and that may become common in 2020. You know that in the digital world, when things really take off, they take off very quickly. So hopefully it'll be useful. So first, I'll talk about the broad Internet of Things landscape. Then I'll give you some pharma examples, and then I'll give you some examples of why I think alliances are important and why I think you as a group, the people here in this room, can make a difference. Many of the changes require many players to converge on a solution, and I think that's something that you could do here. I have a brief section on research we are doing in my laboratory at the MIT Auto ID Labs, and I'll just give you a few examples, and then we'll conclude. So people are talking about the evolution of connected elements, and they're talking about tremendous numbers, and here are some numbers from IBM. These are some numbers specific to the industry, but really I think what's important is that today anything that a camera can see can be traced, because computer vision is getting so effective that all these cars, for example, that are out there driving alone, all these cameras can be connected and they can be telling what they see. So really everything that you can see is connected, and we are eventually going to go down almost to the molecule, so we'll be able to see any protein what it's doing. So let me give you some examples of Internet of Things that are happening that I think can open your eyes. How many of you have a Nest in your house? Okay, nobody. So I guess we have a Jurassic audience here. So, well, this is a simple device. It's a thermostat, like the one that you see over there in the back of the room. There's a few thermostats in this room. This was bought, a thermostat company, by Google for $3 billion, right? Why would a company like Google spend $3 billion on a thermostat company, right? And the idea is that this thermostat has some cool features, like it can be connected to your phone, so you can check. I have it at home, and we can check the temperature at home, and it can see if you are inside or not, because it knows where your phone is. And then if it's a winter and you are on a vacation, it tells you, hey, there's nobody in the house. Should we turn down the heating if you forgot, right? So it's sort of like a neat thing. Then it can check in which rooms you are. So it can also then tell you, hey, in that room you haven't been there for a month, why don't we turn the heating down? It can help you set goals if you want to lower the temperature. So it seems like a neat thing, but that doesn't explain why Google spends $3 billion. The reason why Google spends $3 billion is because this thing is actually working. People are installing it in their homes, and once you connect the thermostat, the next step is to connect the security camera. And once you connect the security camera, you can connect the fridge. And once you connect the fridge, you can then start ordering, and then it gets into ordering, right? And then you can put a device that tracks your heartbeat, and it can then be connected to hospitals. Then you can put it in a baby, and maybe your baby has a problem, and before you find out, there's 3 ambulances that come because Google has sent them, and they decided not to wake you up. So that's why this is becoming big. And that's a fundamental difference. I think there was also in some of the videos that you saw, this notion that everything is connected, and including our body is going to be connected. Then when I show you anything that's connected, any device that you see that's connected, think thermostat. Anything that's connected can be connected now to the thermostat. The thermostat is Google. That means the cloud. That means a whole market of applications, artificial intelligence, etc. So this is the bet of Google. This is Amazon Echo. How many of you have an Echo? There was at least one person yesterday I had given another. How many of you have an Amazon Echo? Nobody has an Amazon Echo. Okay. You should really be worried. I mean, if you want to think traceability seriously and you don't have this, I assume some of you have an Apple iWatch. Some of you, how many? 1, 2, 3, only 4? Okay, it's really worrying. So, yeah, so that's the first thing. If you guys really want to think deeply, and I think you'll get similar messages, you need to try these things. It's like how could you explain 5 years ago what would be the world with WhatsApp, or even before we've all seen these smartphones coming up? How could you explain the world without trying it? So today, just go ahead and try. These things are not that expensive. And so what's the Amazon Echo? So this is a device that you put on your living room, and it's always listening. Okay, it's always listening. And then when you say Alexa, or whatever name you want to give it, you could say, okay, Alexa, play some samba, and it plays music, right? You could say, Alexa, turn off the lights in the garden, and it turns off the lights in the garden. Alexa, and this is a competitive product with the Google one. So it cannot talk to Echo, to Nest yet. But there is a fight here going on to see who's going to have like the operating system inside the house. And you can raise and do many things. And of course, you can say, order soap for the dishwasher. Now, imagine what this little sentence does to retail. Well, when you say order dishwasher, what does this mean for the dishwasher brands? Really, you don't care. Who cares about the brand of the dishwasher soap? It's going to be, and maybe they even have a profile of you, and they'll send you the brand that matches you. So this has a big impact in terms of retail. Now they also have the Amazon Dash, I won't ask how many of you have one, because I know none of you, I guess. I'm learning the lesson. But this is a very little device, and nowadays it can be programmable. So since a month ago, Amazon has released it where you can buy a Dash. And that's a little device that you can put and it can order things. So if you think about pharma, you could tomorrow, literally tomorrow, you could be selling a product that reorders automatically, you know, whatever aspirins or whatever food. You just put it, you buy it, it's very cheap, and when you run out, you press the button, and your companies, not through Amazon, because Amazon has opened up the interface, so through your companies, it can reorder, So I think that's something you should really try, and it's part of the sort of Amazon ecosystem of things that they're trying to do. And then there are other retailers like Darty who's saying, hey, you know, this is a threat to me. So they're putting these buttons on the dishwasher itself. So when you run out, you just press the button and it sends you back dishwasher soap for the next day. And then there's the next step, which is, okay, why don't we do it automatically? And then the device itself, automatically, when it knows that you're running low, it gets you a new one. And you could do that also. You could get a service where you subscribe to a certain drug, or when the doctor, you know, why we still, first, why do we have the whole notion of a prescription? Today is like, that's absurd. You know, the doctor should say, you need these medicines, and in theory, they should appear wherever you need them, right? So, but no, we get this prescription, we need to go, we need to pay. It could all be automated very easily. So beyond the sort of the traceability of the existing supply chain, a lot of people think, let's have visibility of the supply chain. To me, that's such a wrong mental model. That's like saying, hey, I have a new tractor, and I'm going to put a horse in front, and I'm going to work with a tractor, right? What this technology allows is big changes. Don't just think about visibility. Obviously, that's maybe a first step, but there's all these things that are coming that I think you should think about and go for them. So here, this is the Apple TV. They're claiming that the next version, Apple is not doing very well, but they claim that Apple is going to go and play hard on this. This is one of the new prototypes, they say, of the new Apple TV. But again, you get the idea. The idea is to control IoT in the house. And when you mean control IoT in the house, it doesn't really matter whether it's the thermostat or what it is. So in terms of the market, so there are a lot of investments in IoT, and like billions are being invested in trying things. And so here are just a bunch of companies. Let me give you some examples from the pharma industry. Okay, this is a company called AdherTech, and basically what they do is they trace the bottle of the drugs, and you can imagine what you can do. And think thermostat. I mean, that can eventually be connected to the thermostat and be part of the same thing, okay? These are a bit more sophisticated. This is a sensor. They build socks that you can wear, and they provide feedback. You know, I'm doing on the impacts that you're getting. And I'm doing some work at MIT. We're doing a project with Barça on sports and innovation. And they are worried about bone edema and what they can do, you know, to make sure the bone edema is as small as possible so that the life of the players is extended. I mean, imagine if they can get, you know, Neymar's sort of useful life extended by 3 years. Imagine the value. And really, it seems that if you can trace the actual hits that the player has gotten, combined with, you know, they have a Tesla 3 MRI functionality, they can check and they can learn and they can say, okay, now you need to rest, now you can play, and they can get a lot of information from it. These are about cardio information, and there's a number of companies. This is a little sensor, and one of the things about IoT that I think is important that people don't realize, a lot of people think, no, we're going to get visibility, and we're going to get visibility from the tower. This is going to go somewhere, incorporate all the information, and we're going to see it, and then we're going to analyze it. That is simply not going to work, because the amount of information that these sensors produce, the amount of information just of the 20 sensors that this device has, just the GPS, the location, if I had to transfer all the GPS information that's produced here, I would need several terabytes of information. I would need like maybe 1 year of regular transmission just to transmit the data. There's no place to store all the information that's generated. So you need some pre-processing. Here is an example what they do, which is about the maximum you can do. They store, about 20,000, minutes worth of patient heartbeats, but it's pre-processed. You cannot store all the curve of all the heartbeat. So it's very important to think what people call the edge computing. So what is it that the sensor's computing? What's the information that you transmit? Typically, it has to be little information. And that's one of the key things to think about in terms of IoT is, what does the thermostat, what was the element that gives you the information? What is it that's computing? And this is another example. This is another company, Proteus. They have drugs that have a chip. It's pretty amazing. These guys have almost $500 million, and they claim that this is going to change the whole pharma industry. So this whole concept of you getting pills, finding them, trying them, and apparently most people, well, I certainly never follow any prescription I've gotten personally, because it has to be every 8 hours, and unless you feel really bad, or unless you have an adult supervising you, it's very difficult. So these guys, they say, no, but we're going to put some chips, and there's going to be a connection, and then part of the pills will be injected on the skin, and it's going to be like a closed loop thing. And they have some trials. The FDA apparently last month stopped like a broad adoption, but they have some results. And I mean, I'm myself my father is a chemist, but I am neither a chemist, nor a doctor, nor a cook, nor anything that has chemistry in it. I don't know, but so apparently that has to do with the chemistry, how it's introduced, how it's analyzed, and apparently you can even do responsive medicines that will respond exactly to your biorhythms, and if you do exercise, they'll inject more. If you're sleeping, it will inject less, and you can do sort of a closed loop system that apparently for some things like diabetes or schizophrenia, or apparently for some diseases, that's especially well designed. This is another example that was, since the 2000, they have this capsule endoscopy, which is another device that apparently it has some issues. I was doing some research in terms of whether it works or not, and apparently there's about 0.3% of the times where the capsule that you eat with the camera stops, then you need to do surgery and other things. But imagine if this was not an issue, we could be all eating these capsules, and we could get a lot of information, or maybe the capsules stay inside, and that's even more information that we can have. All these are options. Then I brought you this example because I think it also illustrates one of the things that if you as a country, Brazil, want to succeed in IoT, one of the things that you could do, and is think about something that people are going to really adopt. I think you need to think about IoT as a thing that's difficult to adopt, like the thermostats. People are using them, but it's not like everybody is using them. Now, imagine, though, that they give you a sock that you put on your baby, and imagine that it's like $3. And it just tracks, and if there's any issue like sudden death or anything, that you can do something about it, this device tracks it. I mean, which parent on earth is not going to put that? It's like for those that have children, like, it's the one time in your life where, like, the doctor is God, you know, anything, you have that baby and you take care of that like it was amazing. Then they do well and then turn into awful people, some of them. But when they're, you know, you do everything for kids. So that's good in terms of adoption. So you need to think, if you want to get Brazilians to use one of these, you need to think of how you would do it. And there's a lot of research, even professors in economics at MIT have done research on how to get people to adopt and what are the incentives. So you need to think very hard about adoption. For example, they've done tests when you give away vaccines. It turns out that very few people go, but if you pay them like $70 if they come to get the vaccine, a lot of people come, right? And what they found is that under some circumstances, if you give them just a bag of beans, you know, a lot of people will come, and you'll get a very broad adoption. So this is one example. This beans example is another. You need to think about how you're going to get adoption, and that's my next part of the talk is about, you know, alliances and what you should be doing. If you look at what happens on the internet and who are like the winners, if you by 2020 are going to make it big in this space, hopefully you'll be here, and there will be something that will say, you know, the Brazilian sock, okay, or the Brazilian thermostat, or the Brazilian something that can have an impact of adoption, and all of these. You know, like WhatsApp is one of the biggest ones, it's like 20 million a minute. Basically what they did, they had a good way of starting. They started by offering free SMS. It's a very simple thing. I give you a free SMS. People adopted it, and now it's a lot more. Okay, Facebook started with Harvard and said, okay, I'm going to do Harvard, and then everybody wanted to network. And then all of a sudden everybody started using. So each of these examples, they have a starting point. And then what makes them big, which is I think what you should try and generate here, this is like the business model that seems to be working. And so basically you have first and very important economies of scale. So you need to be big so you can invest and improve on the product. Then you need to lock in. So you need to, that's what, you know, Amazon and Google are trying to do. Once you buy an Amazon Echo and you start talking to it and you start programming your dash, buttons, etc., it's going to be very hard for you to change to another device. So you need a way to lock in. I think the government here could do a lot. Lock in. I think you have here the big hospitals. If the big hospitals agree on a system, you know, what other system is going to come into the country, right? So basically the big hospitals are a bit like the harbor of Facebook. So here you could come up, and if you play the role and said, okay, that's my vision. I'm going to bet on these socks for babies, or I'm going to bet on these traceable pills. You need to decide which bet. Then you lock in the system, and then hopefully you get network externalities, which means that the more Brazilians that join the system, the better. That's what sort of happens with WhatsApp. The more people that use WhatsApp, the better. That's why it's difficult now to start with another service. How are you going to start a service that competes with WhatsApp if WhatsApp is free and almost everybody has it? You know, it makes a lot more sense to go there. Okay. So then very, very quickly, you know, some research that we've done at MIT. In my lab, that's the word Internet of Things was invented by Kevin Ashton with Sanjay Sharma in the office next to my office. And that's where the word was invented, and that's where they pushed RFID. That's where it was also broadly adopted. We tried to adopt it in the supply chain in retail, which is doing pretty well. In pharma, it's not doing that well because just with paper you can do it. And what we are now doing is we're trying to make sensors which are very cheap that can provide useful information, okay? And so here we've done things on vaccine freeze detection, fluid level sensing, anemia detection. These are very cheap sensors, less than $1. that you can use and that can provide you information. So like vaccine freeze detection, let me just give you an example. The idea of RFID is just a little computer that you send an image, you send a wave, and it responds with a number. So imagine like a barcode, but it's a barcode, a wireless barcode, just like with your car when you go and it reads your little tag on the windshield. The same thing, very cheap, it's passive, costs cents, it can send information. The idea is that it doesn't just send you a number, but maybe it sends you some blood sensor or some kind of information, okay? And so in the freezing, the vaccine freezing, what we wanted to do is make sure we had a sensor that would tell you whether that the cold chain was broken. And so the idea is we make one of these tags that has a filament that if the temperature deviates either below or above a threshold, it breaks, and you just read it, right? And we've done pretty well, you know, with these sensors, and the idea is to ensure that the antenna that you put there breaks upon when it freezes, and this is an example of one of the tags, and the idea is the time it takes to break, and we've been pretty successful at it. And then, so we have for fluid level sensing, we also have sensors. I'm not going to go through this. I just wanted you to also know this area of research, which I think we've been talking about three things. One is the big IoT thing that's very sophisticated. Later you'll talk about the supply chain and tracing the supply chain, and this has to do with very cheap sensors, okay? And we have also, on anemia, we have a sensor that's very cheap that tries to look at anemia and some of the issues, which I'm not gonna go through. So I'm just gonna skip this part. Okay, good. So let me just go to the conclusions. So I think there's a major opportunity, but the opportunity is to improve the whole system. You need to start with a thermostat, whatever that means for you. That thermostat may mean traceability, so maybe if you do well the traceability piece of the supply chain, that can be the basis to grow from there. I think pharma is an optimal application for IoT, because it's a big sector. You can link it with insurance. So some of, almost half of GDP, you have government, pharma, insurance that can go around it. And I think you should focus basically on new applications. So come up with that SOC or that thermostat that's going to add value, generate good alliance, and focus on regulation. Because I think here the government can be a prescriber. And we were talking yesterday at another panel about Uber and what Uber is doing in Brazil, and you need to think deeply. Is that what we want? Is that the one we want? Maybe we like the technology, but we want to do it differently. And to conclude, I just wanted to show you this image because I think that's where we are in the world of IoT, in a way. So this is one of the first cars. It was called a horseless carriage. And the idea is that if the car broke, you could put a horse in front. And I think that's where we are. A lot of the IoT is not really critical. You have other options, and we're in transition, and we don't really know how the world is. This doesn't even have a steering wheel. And the internet started over 50 years ago. We already have 50 years of history, and we're still evolving. The car took about 50 years since it started, and maybe IoT takes another 50 years, but there's going to be many designs, so you need to be aware that things are going to change, and you just need to play and try to place your bet, and hopefully you will be, Brazil could be the country that figures out the steering wheel. That's, I think, what you should be going for. Okay, thank you.
A próxima palestra é do diretor de Logística Mundial da Rocha, o senhor Matthew Aman, que vai falar sobre tema de logística. Por favor, professor. Please.
Thank you Very much, Professor. Thank you, Brian, to show us a little bit the future. I would like now to come back and step back a little bit and show, in fact, what's happening in the serialization and traceability field worldwide. So I'm working in Roche. I'm in that field of serialization since 2008. I'm member of the European Federation of Pharmaceutical Industry Association as well when we drove the agenda in Europe. And I was initiating and leading the serialization effort in Roche globally. So what I would like to share with you today is simply why the industry is taking action now since nearly 10 years and why also regulators are taking actions. The second one, then I would like to focus on what really matters when implementing a system. I see a situation in Brazil which is a little bit stuck, and I would like to also share my perspective here on how to do what to unlock that situation. And last, also suggest a path forward to you guys here, to the authorities, and how then through a more collaborative approach you can implement something which is at the end good for patients and for the healthcare system. So let me first start. There are two kinds of activities which make healthcare a place which is a little bit dangerous sometimes. There are certainly criminal activities around pharma because it's a very profitable business. You can just fill in a vial with water, sell it as an oncology product and make a lot of money with it. People understood that and they abuse of that, of course. But it's not only about criminal activities, it's also about inefficiencies in healthcare. Healthcare is not known as a very efficient sector always. There is a lot of inefficiencies which is intrinsec to the healthcare system because people are not used to collaborate together, and there is also sometimes mistrust, and as a consequence the handover of the drugs between the trading partners is not always optimal. The way people use and dispense products and drugs to the patients is not optimal. So there is a lot of room for improvement. So the regulators have understood that years ago, driven strongly by the counterfeit issue that we have seen rising worldwide, but not only. And if you look at the picture of the regulations that we had out there in 2009, that's when we started to be concerned about serialization and traceability as a major trend in healthcare. That were the regulations we had out there, 2009. Last year, that's the regulation available worldwide, which have to deal with codification, putting barcodes on the products, having tamper-proof packs, serialization as also a way to increase identification of products, traceability. So all initiatives which is about increasing patient safety and supply chain control, that's the regulations which are out there. So if you believe that Brazil, you are alone here, you are not. You are just one member of a huge community who tries to now fix some issues that healthcare has in the countries. And why is that happened? I mean, technologies arised. First it was RFID, which miserably failed. And then suddenly came this 2D data matrix barcode, which is also a way to put much more information, intelligence into a pack than with a linear barcode. And barcodes which then allow suddenly interaction with healthcare professionals, with patients, and being then technology as a way to improve things for patients, making sure the right product hits the right patient. It's good for healthcare professional. Imagine you can scan your product before dispensing it and avoiding it to give the wrong doses, avoiding it to give the wrong unexpired product or the wrong product to a patient. By simply scanning the product, you can avoid that. And at the end, the healthcare system. We speak a lot about fraud. We should not be happy about people frauding the system. Each time that people do tax optimization, each time that people re-export products and get it reimbursed by the health authorities, each time that something like that happens, it's a financial damage to the healthcare system. And imagine that 5% of your money is just criminally diverted like that. It's 5% of drugs which do not hit patients because the money is not there. So we should not accept that, and we should not be happy with people dealing with this kind of fraud. Now, serialization, I mentioned before, this picture would have been gray a few years ago. And here you just see the places where serialization is either already in place or where law is published and the country is about to prepare themselves. There are not a lot of spots which are not blue anymore. And if you look at that picture next year, you will find a few other countries being blue. And in 2 years, again, a few other countries. So there is a trend in the world which is also linked to this Internet of Things, which has been mentioned before, where healthcare is now moving towards more digitization, and serialization and traceability are enablers for that. So it's an enabler for the healthcare industry, for the healthcare sector to get now into more modern kind of working. And if you look at the people and the countries which have implemented that, there is only positive echo coming from these countries, starting with Turkey. The main issue in Turkey was reimbursement fraud. So people getting reimbursed the same product several times and hurting the financial system. They put that in place. And I will show you just in a few minutes the roadmap that Turkey followed to implement a system. You will see it was really amazing. Argentina as well, huge counterfeit and recalls each time that you had an issue of counterfeit on the market. You implemented serialization. That's what we did in 2010, and since then we have no one single recall anymore because of counterfeits. Korea, the same. We also had here an intense dialogue with the health authorities in Korea, which is now moving to traceability after having implemented first serialization, and before that even 2D codification. US, strong collaboration between the health authorities, between the pharma industry and the distributors, as a way also here to improve collaboration. So that's on the overall picture globally. So I hope you understand you are not alone and you are not a gimme picker. You're not the first one implementing that. A lot of people before you have made also the same experience that you are currently doing with that system. And to say it also, to make it clear, the technology piece is just 1/3 of the discussion. So 30% of the discussion is the technology. 70% is the change management, it's the implementation, it's aligning the politics, it's aligning the people around working principles. It's more the change management piece. It's not the technology. So what matters when implementing a traceability system in a country? That was simply Roche's roadmap in 2009 that we have defined. And instead of trying to fix isolated issues, and we fix here an issue, and then we go to the next, and then we go to the next, we said, what are all these regulations telling us? How will the world look like in 10 years? And we assumed then, and that's a roadmap that you can do also in Brazil for yourself, where do you want the healthcare system to be in 5 years? And what are then the steps towards that? And we said 2009, we assume that by 2020, worldwide, all products will be traced, tracked and traced at item level. That will be a standard. Anything else is even not acceptable. You do not know where the product is coming from, how it reaches the patient. And it's drugs. It's not bananas here. It's not a piece of meat when you go to the restaurant. If you want to know if it's from Argentina or from Brazil, it's drugs. So we should be concerned about that. The second key aspect was that we assumed that serialization would be a strong accelerator and enabler for electronic health and mobile health. And that's exactly what's happening currently. So we are in the middle of that journey, and we see how then suddenly also people start to adopt these technologies and go beyond just the traceability part. So what was important, and that's what we always tried to give as a message when we talked to distributors, to vendors, to health authorities, to regulators, whatsoever, it's a cross-functional effort. It's an effort between engineering, between supply chain, between distributors, between manufacturers, with IT providers, with standard body, and it's important to understand that you are all part of that journey, irrespective of what your background is and what your role is in the journey. The second is that it's important to build an infrastructure which you can adapt and scale. Scale, why? Because you want to add additional functionalities as you mature the technology and the infrastructure in your country. Work together with all stakeholders. So Brian mentioned that we are entering a world of collaboration. It's not the pharma industry against the distributors and the pharmacies against the wholesaler. It's all of us being together in an environment, trying to do the best for the system, the healthcare system, and for the patients at the end of the day. And this new generation, I see a lot of millennials here in the room also, digital natives soon, they are used to work differently. not to compete anymore, but to work together, using the technology and having a complete different mindset towards patient or data privacy or collaboration using modern technologies. So for me, it's really important that here in Brazil, you think big, start small, do prototypes. The proof of concept last year was a first step, but there are certainly others to come, and that you then scale fast, because you don't need 20 years to implement traceability. Turkey did it within 2 years. And if Turkey does it within 2 years, I would expect that Brazil is also able to do it. It's a bigger market, but at least in 3 years. What is also important, don't try to reinvent the wheel. People have done that also before. They have built on certain standards which have proven to work. Just adopt them. Don't try to reinvent and come with a different solution, which requires then everybody to adapt and to make new learnings and new mistakes and again start nearly from scratch. So whenever you do something, base it on international standards which have proven to work in so many other places around the globe. So really use the lessons learned of the world, incorporate what is needed for Brazil, make it fit for Brazil, but at least use the experience done by all these partners and the various stakeholders so far. So having said that now, what could be passed down for Brazil? Let me first start again with this collaborative approach. When implementing serialization traceability, it's not about the industry who wants to control the distributor or the authorities who wants to control the healthcare actors. It's really about implementing something which makes our system better, and where are the benefits for everybody. There is something in there for everybody. The benefits of serialization and traceability are so huge and have so multifaceted aspects that everybody can really benefit from that. So my key message here is really try to do the best for the entire healthcare system, because ultimately, if the healthcare system works better, the patient gets a better product. And never forget, the patient is you. It's your brother, it's your father, it's your sister. It's people behind that. We are in a people business, we are in a patient business here. We don't sell cars or I don't know what. So what is the industry approach and what should our approach be? And we said at the beginning, do we believe we will be successful in fighting against such a trend for more visibility? People are crying and telling us, your healthcare supply chain is not robust, make it more robust, make it better. That's what they tell us. Do we want to put our energy in fighting against such a trend? Or do we not rather want to say, we welcome this health authority effort? Because at the end, it makes it better for everybody. And why should we do that? Because, again, it's about the patient, it's about the healthcare system, and it's also, there is so much in it for us as an industry, as a manufacturer. Your own creativity will be the limit of the benefits that you can gain with serialization. So it really drives healthcare innovation. It moves healthcare towards Industry 4.0 into a digital world. And it's just a question of your own creativity and what you're ready to invest to make it really a benefit for everybody. Why does the industry want to be part of that definition? We did a benchmark last year in December when we looked at the top 30 countries, the top 30 pharmaceutical companies. The top 30 pharmaceutical companies spend $2 million into serialization. That's not, that's not a small amount. That's $2 billion that the top 30 spend into serialization to fulfill regulations which are out there worldwide. And Brazil is just one regulation out of many. So we have gained a lot of experience. And we are ready to leverage whatever the experience is and the infrastructure we have built to supply products according to the Brazilian need. But what is important is we need to do that in a way that we can use and leverage synergies, and because at the end we still have to manage that complexity on the packaging lines. And people are always concerned about the impact on the packaging operations. And it's true. If you adopt international standards and think about your local industry as well, when they have to export to other countries, they are confronted to the same kind of requirements. So the more we harmonize the standards, the better. And we should really also try to exploit benefits beyond anti-counterfeiting on traceability. So there is so much more in there, and I will just show now in a few seconds the example of Turkey, where in fact you see that you can leverage this infrastructure for any other means. So how can the Brazilian Health Authority drive the implementation? The first key message is really build trust. It's working together to define something. And if it's not together, it will not fly. As simple as that. And how can you build trust? By inviting people to an open dialogue, with an emphasis on open dialogue. By articulating long-term expectation. What do you want to achieve? What are the topics or the pain points that you want to address? And where do you want to go in that journey? Provide clear position as a reliable basis for planning, because it must be planned. I mean, you have to change a lot in your supply chain to accommodate with these requirements. And also common principles as a basis for cooperation. Again, it's about cooperation. Because what needs to be defined is the data carrier, which I hope is set, the data construct, which I hope is set as well. But then the database, who has access to data, who builds the database, what are the implementation timelines, how do we ramp up, do we do a prototype, which products and which sequence, etc. So there is enough to be discussed and agreed upon, but again, it's not mission impossible. Other countries did it before Brazil. So it's really a joint effort, where we provide more the technical expertise and, as a manufacturer, the packs which are serialized, where the stakeholder coalition hopefully can build a database to manage then this data, and where at the end also the distributors have some scanning equipment to make it really a working environment. So a true partnership and collaborative approach, because everybody builds part of the puzzle. That brings me now to the Turkish example. So Turkey started also with asking for barcode and serialization 2010. At that time, nobody knew what a 2D barcode is in Turkey. Nobody could read it. And they couldn't care less. They said, industry, I want you to do that. I want you to put this standard in place and to show visibility of that solution. They then give themselves 1 year to build the database. And then they started to ask pharmacists to verify at dispensing, and to motivate the pharmacists to do so, they said no scanning, no money. So if you want to be reimbursed, you scan, because the reimbursement is linked to the scanning event. And suddenly everybody had a scanner, and a health and scanner in the pharmacies. Where at that time people said, yeah, you are kidding, they even don't have electricity, these guys. No, they did it. So it's feasible. They said, no, we have the entry point and the output under control. We want to understand what's happening in between. And they asked then the wholesaler to join. And the wholesaler then had to suddenly start to track and trace, and we of course had to aggregate the products on the pallets. 1 year later, they said, we are now digitally connected, we have an interface, we have everything in place, an IT system in place to connect. Now we remove paper. We go for electronic prescription, electronic invoicing. Now again, you would say, okay, that's dangerous in Brazil because of the nota fiscale and the tax optimization between the districts. So what? That's not important. Important is patient safety. 1 year later, they build an app, and they put it on their homepage, the health authorities, and they allow no patients to verify their product themselves. What's next? Electronic leaflet. You scan a product, and you get leaflet electronically on your iPhone. Or you scan the product at the pharmacy, and there the leaflet is printed for those who want it. With an option, I want a leaflet, yes. I don't want a leaflet, no. We don't need to put leaflets in our packs anymore. For what? The ones who really want it and want to read it, they should receive it. But not waste of paper and work, and then paper which sometimes is not up to date anymore. If it's online, it's up to date. Adverse event reporting. Imagine now that every single product dispensed to the patient has a number. You can build your adverse event reporting on that. You know exactly which product was dispensed to whom, when there was an adverse event. You can build your whole pharmacovigilance system on that system. And again, as I said, what's the limit? There is no limit. It's just a question of creativity, of political will, and at the end, making or building a system which has benefits for everybody. And Turkey did that within 4 years. They started 2009, the first implementation 2010, and they finished in 2014. It's not mission impossible again. And the same, by the way, effect that you see here, we observe in other countries. Because whenever a country starts to implement, then suddenly they see, there is more in it, and they extend it. So I hope you understood that serialization is really an enabler towards an increased digitization, because barcodes now suddenly allow interaction in a digitized way with healthcare professionals, with patients. And this development cannot be stopped. I mean, Brian said it better than me. It's something which started and it cannot stop it. And the greatest risk for Brazil would be to be unprepared, hesitant, or too timid to act. Because I just mentioned a few of the benefits underneath that you can generate with serialization. For me, it's really awesome. And why I'm so enthusiastic about that topic is because that's now really a topic which brings healthcare in the 21st century. And the benefit of that will all go at the end to our patients. So making sure the right patient gets the right product, the right dose at the right time, so there's a right route. And in a digital world with serialization, I would even like to say we can extend that to 7 patients' rights. So getting the right information, the reliable information, up-to-date information, and not the leaflet which has been printed 4 years ago, and through a reliable supply chain, because suddenly we exactly know how the product reaches the patient out of their various locations. And by doing so, I'm sure and I'm convinced that we do know what patients need next. Thank you very much.
Bom dia, meu nome é Laura, eu sou médica oncologista no ICESP, Instituto do Câncer do Estado de São Paulo, que fica aqui na Dr. Arnaldo, associado ao complexo aqui, faz parte do departamento de radiologia do professor Thierry. Eu vim hoje representando o Dr. Paulo Hoff. Dr. Paulo Hoff, infelizmente, não pôde estar aqui hoje. Ele é diretor do Instituto, também diretor da Oncologia do Hospital Sírio-Libanês, onde eu também trabalho com ele. E Dr. Paulo está no Congresso Mundial de Oncologia, ASCO, e não pôde vir, eu vim representando. Queria agradecer, para mim é uma honra representá-lo aqui falando nesse tema tão importante de rastreabilidade de medicamentos. Eu vim aqui falar do ponto de vista tanto de quem cuida do paciente, mas também colocar a perspectiva do paciente oncológico para que vocês... lógico que vocês têm muito conhecimento nessa área, mas a dimensão que isso tem para o paciente, na ponta, quando a gente chega, o quanto a rastreabilidade de medicamentos é importante e o quanto, naquele vídeo que a gente viu no começo, que tinha aquela ponta do iceberg, o quanto isso pode ser realmente no Brasil o ponto de início para que a gente possa ter mais informações e melhor cuidado ao paciente oncológico. Então, vocês viram naquele vídeo também o que era o Cancer Moonshot. Eu vou falar brevemente, eu não sei o quanto vocês já tiveram a oportunidade de ouvir sobre esse assunto, mas no final do ano passado, o filho do vice-presidente dos Estados Unidos faleceu de câncer. Isso levou não só a iniciativa do governo lá, mas de várias outras instituições de se mobilizarem nesse projeto que teria como objetivo que em 2020 a gente tivesse a cura do câncer. A gente é muito positivo, que a gente acredita que esse projeto possa ter mais êxito. Em próximo da década de 70, o governo americano, junto com o NIH, desenvolveu um projeto para tentar alcançar isso. A gente... muitíssimo dinheiro foi investido e muitíssimo trabalho de cientistas empenhado em conseguir esse objetivo. E hoje a gente tem um entendimento muito maior do que é esse problema. Então, a gente sabe que não é uma doença só, são muitas doenças e possivelmente não existiu uma cura do câncer. Se tudo der certo, teremos muitas curas para cada paciente. E é justamente esse aqui, mais alto? Falar mais alto, ok. Se alguém não estiver me ouvindo, por favor. Provavelmente o futuro é a cura de cada paciente e para isso a gente precisa de informação. A tecnologia que a gente se depara hoje, a internet das coisas, é algo que vem para ajudar nesse sentido e o projeto do Cancer Moonshot foi desenhado justamente da gente conseguir integrar dados de pacientes. Então, na verdade, esse é o core. E com isso você conseguir integrar de forma a aprender. Então, o sistema seria um sistema que aprenderia, não sozinho, obviamente, com a ajuda de pessoas da área de tecnologia de informação, para justamente conseguir com que a gente aprenda mais do que sozinho olhando os dados, que todos aprendam. A grande preocupação que a gente tem, nós como médicos eu acho que a sociedade deve ter, o quanto isso representa a segurança do dado do paciente. E eu acho que isso é um ponto muito importante de discussão nesse seminário. A gente vai estar falando aqui hoje da criação de um sistema onde muitas informações vão ser ligadas num cadastro único nacional. E essas informações, claro que elas têm relevância para o supply chain, para que essa medicação chegue da melhor forma para o paciente, que isso seja seguro, mas da mesma forma o paciente tem que ter a segurança de que aquele dado é dele e a sua identidade esteja preservada, a sua confidencialidade esteja preservada. Então, isso é muito importante. É lógico que todos os players nessa cadeia têm interesse em ter acesso às informações, mas a gente tem que sempre primar pela segurança e pela confidencialidade do paciente. Então, acho que esse é um ponto muito chave de discussão no dia de hoje para vocês. O Cancer Moonshot também tem essa prerrogativa de também manter a confidencialidade do paciente, mas eu só vou falar mais ou menos como é hoje, como esse projeto pode ajudar e realmente fazer uma mudança de paradigma da forma com que a gente aprende. Então, hoje, como a gente aprende, como a gente avança. Então, você tem uma molécula, um mecanismo novo, alguma coisa que foi visto na ciência básica, alguém descobriu alguma coisa que parece que funciona para combater essa doença. Isso vai escalando nas fases de pesquisa clínica e até que a gente culmina num estudo de fase 3, onde você randomiza os pacientes para um tratamento padrão, para uma abordagem padrão e para abordagem inovadora. Isso, normalmente, para você ter uma medicação aprovada, você requer centenas a milhares de pacientes para você dizer que aquela estratégia é melhor do que a estratégia anterior. Isso não só consome recursos, mas consome muito tempo. Então, para cada nova molécula, para cada novo medicamento, para cada novo avanço, isso leva muito tempo, desde o desenho de um estudo, de uma ideia que a gente acredita que possa ser melhor, até ela efetivamente ser comprovada. Dessa forma, a gente vem avançando, por muitos anos a gente vem acrescentando e mudando a história natural de muitas doenças. Infelizmente, a gente não chegou no objetivo final de que a gente não tenha mais esse sofrimento, mas a gente com certeza diminuiu muito o sofrimento relacionado a essa doença no mundo. A gente, humanidade, todos os que estão aqui presentes fazendo esse trabalho. Esse trabalho consome muito tempo e a gente não quer esperar mais. Então, o desenho do Cancer Moonshot é justamente com que... hoje eu tenho esse dado, então eu li um novo artigo, tive acesso a um novo tratamento, eu vou avaliar a minha paciente, vou falar, olha, nesse momento o melhor tratamento para a senhora é esse, baseado na melhor evidência de um novo tratamento que acabou de ser aprovado. Essa paciente vai fazer esse tratamento, vai ter uma resposta... E essa informação fica comigo, com o meu hospital no máximo, com os meus colegas no máximo, se eu um dia resolver publicar a minha experiência e compartilhar isso em congressos médicos. Isso não se integra, neste momento, de forma alguma, com uma paciente que esteja sendo tratada na Turquia, na Europa, nos Estados Unidos. Hoje em dia, a gente coleta uma quantidade enorme de material, tanto biológico quanto de imagem. A gente gente tem extensa fonte de informação para cada paciente, para cada tratamento, e isso não é integrado. Então, no Cancer Moonshot, a gente teria uma forma de integrar todos esses dados. Isso, dessa forma, a gente conseguiria aprender e o sistema aprender. Esse projeto também integraria todos os dados dos estudos clínicos. Então, a gente conseguiria ter online ou mais rápido acesso a resultados de estudos que estão em andamento. Cada indústria tem a sua molécula, mais ou menos no mesmo caminho. Hoje em dia, vocês provavelmente ouviram falar em imunoterapia no tratamento da doença oncológica. Cada indústria tem a sua molécula e esses dados são tratados separadamente por N motivos. Obviamente, também, cada indústria quer desenvolver o seu produto, mas talvez a gente aprendesse mais se houvesse alguém que pudesse olhar esses dados, e alguém pode ser um computador, alguém que desenha um programa que consiga olhar esses dados e nos dar direções mais rápidas para onde, assim, não, nesse caminho não está bom, esse está um pouco melhor, vamos todos para cá e vamos todos juntos. Então, esse projeto é um projeto muito ambicioso e ele usa basicamente a informação de todos os dados. A segurança do paciente, que a gente precisa manter essa confidencialidade e que a gente possa usar isso para uma melhoria. Aqui a gente está discutindo no Brasil a ponta do iceberg e que a gente vai começar existem várias iniciativas. O Cancer Moonshot, ele tem um projeto ambicioso nos Estados Unidos, mas todas as empresas que estão participando desse projeto têm os olhos no Brasil. A IBM tem o projeto do Watson, a gente vai ter debate sobre isso em breve, da gente conseguir colocar os dados integrados dos pacientes do Brasil. Mas, pelo fato da lei de rastreabilidade ser algo que ele vai ter que ser aplicado e já está em andamento, eu acho que a gente tem um potencial muito grande de começar por aqui. O que o paciente recebe tem que ter não só a segurança, mas se a gente pudesse saber qual foi o resultado dessa medicação naquele paciente, seria absolutamente fantástico. Vai ser falado aqui mais para frente do projeto piloto. O ICESP, como instituição, participou de um projeto piloto. O professor aqui pode falar muito mais do que eu, o Thierry, todo mundo, que o ICESP participou ativamente do desenvolvimento do piloto em conseguir rastrear até o miligrama do paciente. Então, a gente sabe daquele frasco que é fracionado. No ICESP, a gente consegue saber qual paciente recebeu cada frasco, que isso é uma coisa que, infelizmente, não é viável no Brasil ainda. Eu acredito que esse seminário tem um grande potencial de ajudar o paciente na ponta, aquele paciente que precisa do desenvolvimento de novas tecnologias o quanto antes e da segurança daquele remédio que ele está recebendo. Eu só queria aproveitar para comentar que a gente tem as palestras que a gente ouviu aqui, eu acho que foram muito enriquecedoras. Eu só queria comentar, não sei quantos de vocês têm bebês em casa, mas eu acho que uma meia jamais seria um produto para um recém-nascido, porque ele invariavelmente vai acordar sem a meia. Mas a grande questão é que eu acho que a gente tem todos esses dispositivos da Amazon, todos esses dispositivos são formas para rastrear tudo que a gente faz. Lógico que tem muita gente que está muito mais interessada em vender produtos, porque esse é o business deles. O nosso business é cuidar de pessoas. E para cuidar de pessoas, a gente pode usar todos esses recursos, coisas que a gente ainda não imaginou, justamente para cuidar de pessoas. Então, aqui eu sei que tem mentes brilhantes e muito dedicadas a esse assunto, e eu queria pedir para vocês que continuem nesse trabalho para nos ajudar a entregar para o paciente o melhor cuidado possível. Muito obrigada.
Bom, pessoal, ouvindo? Vamos passar agora para a parte de perguntas, né? Fique à vontade.
Bom dia. Uma pergunta ao professor e ao senhor Mathieu. Vou fazer em inglês. Regarding the business model, I mean, you talk about a win-win situation. In theory, when you introduce a new technology in the supply chain, you have an impact on the cost and benefits of all the actors. Who pays your, for example, you pay the technology for all the actors, and for example, you introduce a fee for service for getting economical benefits.
For that, do you hear me? That's always the question, and that's why the discussion is often difficult in that space. Of course, the industry pays a big part and the biggest part of the costs because we have to invest into the technology, into the IT, and in the European model, for example, we are even forced to pay for the database. Then the distributor, they have to equip, of course, but distribution of pharmaceutical products is logistics management, and I cannot believe that today's distributors do not already have barcodes in place and IT systems to trace, to do an efficient goods received and goods issue posting, so whatsoever. So here it requires an adaptation, not necessarily an investment. The investment then at the end is also at the dispensing point, being it in the hospital pharmacy or being it at the pharmacy, where scanners have to be bought. But again, there the investment can be leveraged to have a better inventory management. So at the end, if you invest just to fulfill the requirement, then it costs you money. If you invest it with an intent then to optimize your own operations, then suddenly it's not an investment anymore. It's really, I would say, it's not cost anymore, it's really an investment in the future. And that's what we did. I mean, a big part of the investment that we do in serialization is not linked necessarily to serialization. But we have to modernize the packaging lines, because you cannot simply add something on top if the packaging line is too old, for example, and we do it in a way that we then at the end optimize also the whole. Now to bring it to the point, the costs at the end of the day, we don't speak about millions. So implementing barcode readers, scanners, and tracking your products through the supply chain, that will not make your service 50% more expensive. It's in a ratio of a few cents per pack.
Yeah, I think that in terms of IoT applications that may be disruptive, you need to look at each case differently. Like, for example, in WhatsApp, nobody pays, it's free. And the value it produces is amazing compared to what was SMS. I think you need to think first about value for the user. In the case of WhatsApp, it's a very clear example. In case of pharma, you need to look at each application and see if there is value. I would suggest starting where there is real value. And then the other piece is competition. Why they don't charge us for WhatsApp? It's because there will be a competitor. I mean, the day WhatsApp charges 3 reales, we're all going to switch to a free one, right? And then in terms of devices, some of these devices are expensive, and then it's a bit like the phone. The phone used to be subsidized, now it's not subsidized. So, but at the end, it's the consumer who will end up paying. So you have to provide value to the user.
Thank you. I'm trying English, okay? So that's my personal feedback. The reason I do not have the my home, the reason I do not have the eco, the Amazon, it is because in Brazil, it is a tropical country, okay? And weather is not that important for us in terms of we need to turn our reach or not. Just a feedback. But going to the serialization, I've been a lot of forums like this. But how are you working? Are you working closer with the telecommunications company? Because Internet of Things and serializations will not work without we have a big partnership with the telecommunications company. As we were explaining in Brazil, reality of the data transmissions in São Paulo is totally different when you compare to another states in Northwest, for example. So in your experience in Turkey, How it is the internet there? Is the government partnership sponsoring better telecommunications in those countries where you have implemented the serializations and traceability there? That's my question there. So.
Yeah, well, I think that the issue of internet coverage, it's a big one. But other than that, I think telecommunication companies have been really bad at any sort of innovation. So maybe they'll do it differently, but they miss the mobile commerce, they miss payments, they're missing IoT, they're missing everything. So I'm not sure if it's a good partner now. Internet coverage is important, Wi-Fi, etc. All you can do there, it's good. But in Sao Paulo, I've been using my international plan. It's worked pretty well. So, but I agree, outside is an issue. And there are some actually IoT solutions that don't require perfect communication, and that's, I think, something you need to think about is like the plan B. And so some of these devices, they can have autonomy for some time.
Pela minha experiência, infelizmente, as operadoras estão investindo muito pouco em internet das coisas, né? Então, está passando o bonde e o pessoal está deixando passar, né? Isso é um problema comercial de cada empresa. Agora, a internet das coisas, se você for ver as discussões, poucos fóruns chegam no detalhe que estão chegando aqui nessas palestras. O pessoal faz um show, mas de prático nada. O que é lamentável. Sim, todo mundo gosta de falar de internet das coisas, virou papo de pinga, quer dizer, em qualquer barzinho o pessoal fala isso, né? Mas de resultado zero. O que a gente está querendo é começar a ter resultados, por isso a presença dos consultores internacionais, trazendo experiência de lá para cá. Ok? Please, if you want to answer.
So yes, the infrastructure is really an important question. Is there a Turkish in the room? So I always say, if Turkey did it, you should be able to do it. But other than that, and not to joke, yes, you have to involve that if it's an issue, or you have to build an infrastructure which can then cope with this kind of electricity, power, downtimes or whatsoever, and not putting everything, the infrastructure in a place that allows to also catch up in such a situation.